if I told you your period could make you feel suicidal? Would you believe me? I'm Dr. Nagat, an NHS GP and a specialist in women's health and the author of The Knowledge, Your Guide to Female Health from Menstruation to the Menopause, where I cover premenstrual dysphoric disorder, PMDD. What exactly is premenstrual dysphoric disorder? Well, it's a cyclical, hormone-based mood disorder with symptoms arising during premenstrual or the luteal phase of the menstrual cycle, and then it subsides within a few days of starting your period or menstruation. While PMDD is directly linked to the menstrual cycle, it's really important to know it's not a hormone imbalance, which we keep telling women. PMDD is a severe negative reaction in the brain to the rise and fall of estrogen and progesterone. As there is no blood or saliva test or a scan or an MRI scan I can do to diagnose PMDD, there are other tests that we can do to make sure that we rule out any underlying diagnoses. The best way to know that you've got PMDD is to track your symptoms for 2 menstrual cycles. It's estimated that 5.5% of women and girls are affected by premenstrual dysphoric disorder. And the crazy thing is PMDD has been commonly studied in white women. Consequently, we don't know if PMDD varies by race. Subsequently, the bioculture model of women's health and research on psychiatric disorders actually suggests that Black women are less likely to experience PMDD in their lifetime. But that is actually based on a little research apart from which looked at one study in 2011, which looked at case notes and questionnaires. So I questioned the accuracy of that report, which was saying that Black women are less likely to suffer from PMDD when we know that discussing period and also symptoms are related to mood and psychological impact of our periods is less talked about within the Black and Asian communities. Therefore, knowing the symptoms of PMDD is really important. So here are the symptoms to be aware of. Mood changes, so sudden mood swings, feeling suddenly sad or tearful or increased sensitivity to rejection. Irritability, anger or increased conflict within yourself or other people around you. Depressed moods, feeling hopelessness, feeling worthless or guilty. Anxiety, tension or feeling like you're being keyed up or you're on edge. You have decreased interest in usual activities such as work, school, or friends or hobbies. There's also difficulty concentrating or focusing or thinking, so women complain of brain fog. There's tiredness or low energy. Changes in your appetite, so food cravings, overeating or binge eating, or hypersomnia, which is known as excessive sleepiness, or insomnia, where you have real troubles falling asleep. You're feeling overwhelmed or out of control. Physical symptoms such as breast tenderness, or swelling or joint or muscle pain or bloating and weight gain can also happen if you're suffering from PMDD. One of the things that I'm really aware of is that some patients really struggle to get a diagnosis from their PMDD, and particularly from those of Black and Asian heritage, because we have a difficulty of communicating our symptoms. And the really is because actually the diagnosis is hard to make. As I said, there's no test. So it can take a long time to realize that your symptoms are associated with your cyclical change. And also because PMDD is not well known. It's not even well known amongst some health professionals. And PMS, premenstrual syndrome or tension, PMT, can also be diagnosed instead of PMDD, which can be really frustrating for you and also for your doctor who's trying to help you. If you feel like your doctor is overlooking something or not taking you seriously, which unfortunately can happen, there are things that you could try, and here are my advice. Firstly, keep your own detailed records of your symptoms over time. You can do this in a diary or you can download mood charts from the internet. The more information you collect over a long period of time, the better prepared you'll be to explain your symptoms to your doctor. Take the PMDD treatment guidelines with you to your GP appointment. That's the National Institute for Health and Care Excellence, NICE, and the International Association for Premenstrual Disorders. These both provide detailed step-to-step guidelines on the diagnosis and treatment for PMS as well as PMDD. Ask your GP at the practice if you can speak to a doctor who specializes in mental health, gynecology or endocrinology, or a GP that does women's health, because not all doctors do that. Gynecology is a branch of medicine that specifically only looks at female reproductive systems, and endocrinology closely looks at hormones, so you might need a combined or multidisciplinary effect. The other thing I would always say is consider finding an advocate. An advocate is someone who can help you come to the appointment with you, keep a list of symptoms, and also be able to offer the information that you might be too embarrassed or unable to communicate in the consultation. You can be completely empowered to have a conversation with your doctor and keep going back. Sometimes it's difficult to diagnose on one appointment alone.